Monkeypox. The name of the new terror in the world is monkeypox. The number of monkeypox patients is increasing day by day in the world. Today's video of us with this new panic. The video discusses in detail what monkeypox is, its symptoms, things to do and its source. Watch the full video without missing a second and learn the details. The monkeypox virus has created a stir around the world. Before the coronavirus went away, pox NSRE, than 1,000 people have already been diagnosed with the disease in 30 countries around the world. Will this contagious disease be a cause for concern again? Will it also take the shape of an epidemic? Let's not know in detail about this disease. What is monkeypox? The disease is caused by a virus called monkeypox. The virus was first discovered in monkeys in 1958 in a Danish laboratory. The virus was first detected in humans in the Democratic Republic of the Congo in 1970. One of the two types is West African and the other is Central African. In this case, the risk of death is significantly higher in the Central African type, 10.6%, than in the West African type, 3.6%. More than 1,000 cases of monkeypox have recently been reported in 30 countries where cases of monkeypox were not commonly found, prompting public health experts to reconsider. The cases have been identified in Australia, Belgium, Canada, France, Germany, Italy, the Netherlands, Portugal, Spain, Sweden, the United Kingdom and the United States, all of which are West African. The symptoms of monkeypox are much like those of smallpox or smallpox. The relief, however, is that it is less contagious and less serious than smallpox. The patient recovers within 2 to 4 weeks. In addition, the death rate is low. Symptoms of monkeypox. Closing parenthesis. The first symptoms of monkeypox usually appear within 6 to 13 days, in some cases within 5 to 21 days. It causes fever with chills, headache, muscle aches, back pain, fatigue and weakness. However, the main difference from smallpox is that it causes swollen lymph nodes, some glands in the throat, bogle and groin. The rash usually appears within 1 to 3 days after the first symptoms appear, first spreading to the face and then to other parts of the body. The rash around the genitals and anus has been the most recent outbreak of the monkeypox virus. These blisters later turn into blisters and cause severe itching and pain. When the symptoms of monkeypox appear, the infected person becomes infected, meaning that the disease can spread to others. The disease usually lasts for 2 to 4 weeks and the patient recovers on his own. The symptoms of this disease are usually mild, but in some cases the disease can be severe for children, pregnant women or those with low immunity. In recent times, the mortality rate from this disease is 3 to 6%. Complications. In some cases, monkeypox causes some complications in the body. For example, infections can spread to different parts of the body, lungs, brain and eyes. If the infection spreads to the cornea of the eye, the patient may also lose sight. The way monkeypox spreads. Usually monkeypox does not spread from person to person very easily. But the disease can spread to a healthy body if it comes in direct contact with an infected animal or person or if it comes in contact with wounds or blisters on the body. Sexual intercourse with an infected person is one of the reasons for the spread of the disease. Monkeypox can also be spread by sneezing, coughing, spitting or prolonged face-to-face contact with an infected person. It can also be spread by contact with an infected person's used items, such as clothing, bedding, towels, etc. Treatment. Anyone with a rash and fever, fatigue or abnormal weakness should seek medical attention and be tested for the monkeypox virus as advised by the doctor. The PCR test is by far the most reliable for detecting monkeypox. In this case, samples are collected from the skin wound site. It is also possible to diagnose the disease through biopsy. People who are suspected are completely infected with the monkeypox virus must stay away from the body until the rash subsides and refrain from all physical contact. To reduce the incidence of monkeypox disease, the advice given by the doctor should be followed. In addition, caregivers of the affected person must adopt self-defense techniques as much as possible. There is no specific treatment for monkeypox. Therefore, the doctor prescribes medicine to reduce the symptoms of the disease. Studies have shown that smallpox vaccine is about 85% effective in preventing this disease. In addition, antivirals and immunoglobulins are being used in many countries. Although no reliable information has been found about its effectiveness. What to do to prevent monkeypox? Properly covered, it will withstand a great deal of adverse conditions. Point 1. Talking too close to a person with symptoms of monkeypox and avoiding physical contact. Point 2. If someone in the family is infected, keep him in a separate room and use the mask of everyone in the family. Point 3. Avoid sexual intercourse as much as possible, use condoms for special needs. Point 4. Refrain from contact with any substance used by a person infected with monkeypox. Point 5. Wear a surgical mask as it spreads through the respiratory tract. Point 6. Regular hand cleaning with soap or alcohol hand sanitizer. Point 7. Boil the meat well during cooking. Point 8. Refrain from contact with any sick, dead or wild animal. The spread of any monkeypox in the world so far is not so prevalent. So having the right idea about the disease in time is the best way to prevent monkeypox. Thanks for watching this video and please subscribe our channel.